two forms of home care. There's regulated home care, where the agency is managed and has to register with the Care Quality Commission, the regulator. Or if you've got a direct payment or your own money, you can choose to engage an individual care worker. Sometimes they're called personal assistants. And effectively, in that case, you become the employer.
Hi, and welcome to the Chasing Care podcast. On today's episode, I'm delighted, in fact, I'm amazed to say that we have Jane Townson of the Homecare Association. That's Jane Townson OBE. She really knows her stuff when it comes to the care sector, and I'm really thrilled to have her on board. And what we've decided to do is talk about the general idea of what is home care, because most of the general public don't understand it. And that's you, the audience, listening in today. But before we get down to that, Jane, welcome to the podcast.
Thank you, Gavin.
Just introduce yourself, will you?
Thanks very much, Gavin. Thank you for inviting me. So I'm Jane Townson, Chief Executive of the Homecare Association. We represent and support providers, regulated providers of care and support in people's own homes. And we can talk a bit more about what that looks like later. I've been doing this role for 5.5 years. And prior to that, I spent 8 years working for a not-for-profit care provider. We delivered home care, housing with care, complex care with nursing, supported living for people with disabilities, and operated 30 care homes. So I've had good experience across different settings of care. My first career was as a scientist, though. I accidentally became a care C after 14 years working in international bioscience companies in research and development.
Well, a lot of people accidentally fall into care, but they find it's a passion when they get involved. Is that how you feel about it?
Oh, there's just so many things that need improving and such a difference that can be made to people's lives. And that's what is so motivating for everyone that works in the sector.
Absolutely. I've spoken to so many people on the podcast, and it's the same theme all the way through. They're passionate about it. They want to improve it. They want to help people have a better later life. That's absolutely for sure. And of course, it's not just later life, is it? It's something which can affect young adults too.
Yeah. Our members, actually, some of them support children, most support adults, but that's adults of all ages. So as you say, and about at least half of council budgets are spent on social care for under 65-year-old adults.
Well, let's not get into the politics too soon, Jane, because we all know that the care sector in communities is underfunded, and you'll just get me on my hobby horse again. And I don't want to do that today. I want to be the general public. I'm going to start not knowing it. Well, I probably don't know anything anyway, to be fair. But I'm going to put my brain in the perspective of the general public right now. And we're going to run through a number of questions, the questions that tend to be asked, and they are straightforward concerns. So the first question I've got for you today is about generally just understanding home care. What exactly is home care, and how does it differ from other forms of care like residential care, for example?
Well, home care is care in people's own homes in the community, and it takes really a large number of forms. That's the great thing, because the whole idea of care and the intention behind the Care Act 2014 is that the care is tailored to the individual. And when you've got one person living in their own home or a family that you're supporting, it is possible to be quite personalised in what you do in a way that you can achieve quite a lot in a care home. But once you've got, 90 people living in a care home, let's say, it becomes harder to do 90 different meals every mealtime. There's got to be a certain amount of standardization, if you like. I mean, it's amazing how much personalization does get done, but there are practicalities as well. So home care, first of all, it should be said that most of it is actually paid for by councils or the NHS. So 79% in total of home care services are purchased by councils and the NHS. Some people pay for their own care. So we tend to refer to those as self-funders or private pay. And typically when people buy their own care, they have more flexibility about what they can have. So they will tend to buy care earlier than is often possible with council funded care. So that means that they will pay for companionship, for support with domestic tasks, cleaning and so on, maybe support with going out and about to visit friends. And it would be lovely if that were available for everybody, regardless of the source of funding. But because councils have had to ration their budgets because they've got more needs, more people that need care, and their budgets have been squeezed for 14 years because of austerity. So with the state funded care, often people have got healthcare needs, and so the care will range from personal care, so supporting people with activities of daily living, getting in and out of bed, going to the bathroom, cooking, those sort of things, through to more complex healthcare support. So people may have uh, stomach feeds, they may have complex catheter care. Quite a number of people actually die in their own homes. They choose to, and so the end of life care is a big area. People will have dementia, frailty. So the care workers need substantial training and support to be able to deal with all of this vast array of needs. Sometimes, especially with the younger adults in more supported living, so that's where a younger adult will live in their own home, but they may need more intensive support. So sometimes there'll be a care team, maybe of 6 people all together in shifts, who will support people pretty much 24/7 with whatever they need to do. Some people in that situation actually go out to work, and it's supporting people to do that and carry on living in a as independent a way as possible. Other people are sadly bedbound and need different kinds of support. So it's very, very varied. I think that's one of the interests of it. And a lot of the care workers, they absolutely love it because they hear all of the stories, and the people that they support, some of them are quite they've had loads of life experiences and they've done all sorts of interesting things, and the relationships that develop, that is what a lot of people talk about on both sides. People receive home care services, they quite often feel that the care workers are almost like part of their family.
Yeah, I think the phrase that we hear a lot, isn't it, is independently living at home, or something around that sort of phrase. Whereas when we think about care homes, it's not really independent living, is it? It's I don't know. How would you describe the difference between that before I go off on one again?
Well,
because I hear just so many people going to a care home, and they only about 30% of people actually leave it to go out on a trip anywhere. Whereas home care is a different beast, isn't it?
I think things have changed a lot over the years because we can support people with quite advanced needs at home. Fewer people, I mean, people get to reach a more dependent state, if you like, to even go into a care home. So typically, it would be people that have, say, got reasonably advanced dementia. They were perhaps on their own at home, and it isn't safe for them to be there anymore because they might go wandering, or they might leave the oven on, and there's various technology solutions that can help with some of that. But
Mm.
or people who have become really quite frail, and they can't do things like move around or open
Mm.
cans, or that. So that I would say the level of need of people in care homes has really increased a lot. I mean, way back in my previous role, we had some residents in our care homes who had literally lived there for 30 years, because there was a time when you could go down to the benefits office and effectively get a bag of cash without an assessment and check yourself in. And loads of the residents used to drive. All their cars were parked up outside, and they'd all go off in their cars at lunchtime and play bingo or whatever. And there was one lady in one of our care homes eventually died at the age of 102, but she had moved in when she was about 70. Whereas
Oh
now
wow.
the average length of stay in, say, residential care is probably more like 2 to 2.5 years, and in nursing care,
Mm.
more like 1 year. And in some cases, the care homes are effectively used like hospices for old people. And people are discharged from hospital who are really quite poorly and spend their last days there. So I think everything has shifted up one. So it's going way back. People used to be put in geriatric wards of hospitals, and then everything has sort of moved up a notch. Those people are now in care homes, and then the people that were in care homes are now being supported at home. And I think a lot of care homes do brilliantly in enabling, but going back to my previous role, way back, some of our care homes used to take the entire care home on holiday. And it would just be, and there's all these photographs from those days, but it's really hard to imagine that even being possible now, just because the level of need has gone up so much. That being said, there are people that do get supported to go on holiday, so it does happen. It's just
sure, yeah. There are some really, really good care homes for sure, and nursing homes. Coming back to something you mentioned before about the tasks that the carers might fulfil for somebody, I know it's going to be very varied, but typically, what would the carer be there to do for somebody in their own home? I'm just jumping into this episode, which I hope you're enjoying, to ask for a favour. It's really important to us to get likes, shares, following and comments about the Chasing Care podcast in order to build the audience. So if you know anybody that's in the care sector or thinking about care for a family member, maybe you could like, recommend and share. Let's get back to the episode.
It does really vary a lot, but the main personal care, often it would be helping people get out of bed and get up and dressed, and helping with meals, washing, bathroom, that kind of thing. And also, as mentioned, healthcare support. It does very much depend on the person's need.
All right, well, it leads me neatly into the next set of questions, which is about costs and payments. What is the difference between a private pay home care service and a local authority funded care?
Well, first of all,
can everybody get it for free?
No, it's means tested. Social care is means tested, and anybody with assets more than £23,500 has to pay in full for their care. Now, that's a very low threshold. I mean, that's probably a garden shed in the south of England. And it's only when you get assets below 14,000 and you've got an eligible need that you will get your care paid for in full. There is an exception with the NHS because you can apply for continuing healthcare funding if your healthcare needs are sufficiently high. But to your question about local authority funding, there are 153 local authorities in England that purchase care from independent providers. Every single one of them has a different fee rate for home care.
I don't want to worry the listener, but that is a little bit shocking. And I know it's something that you champion extensively with the government. And I wish you well in that journey. It's been one that's been going on for many, many years, and I don't see an end to it personally. But let's flip it back to the general public, if I may. If I do qualify for local authority care, what sort of care am I entitled to?
Well, first of all, if you think that you might need some help, you need to speak to your local council. So you can go onto their website, contact them. They will hopefully send somebody to assess your needs. Unfortunately, councils have got quite a big backlog of assessments. So there's over 400,000 people waiting to be assessed at the moment. But if you have an assessed care need, then the council, the social worker, will have a conversation with you about how those needs can be met. But the way sometimes it can be quite prescriptive. You will have care for half and 30-minute calls at this time of the day, 3 times a day, and you will have this provider. There isn't always that much choice and control as far as the person drawing on services is concerned.
So if the local authority is going to pay, they're going to decide what I can have. What about if I want a bit more than what they're willing to give me? What happens next? What about if I don't agree with what they say I can have? Can I challenge that?
Yes, you definitely can. And they should. the social workers have all been trained to listen to people, and they do their best with the resources that they've got. It's just very, very challenging because of the policies of successive governments. I mean, it isn't one government, it's all of the governments of all parties have failed to address social care and the needs of our ageing population.
Okay. The local authority has agreed that they will assess me because I don't have the money. So they're going to pay for it for me. That's great. Do I have any choice as to which care provider walks through my front door?
It depends. So you can either choose to have the local authority arrange the care for you. The way a local authority does that varies. So there's 153 different ways of doing that. You can choose to have what's called a direct payment. The local authority will effectively give you money, and then you're treated like a self-funder, except you're not really, because they still have quite a lot of say over what you can and can't spend that money on. And also, another problem is that in many places, the direct payment rates that they offer are quite low compared with their rates for managed care. So that limits what you can do.
It sounds to me, therefore, that whilst I could opt for the money, it's closely managed as to what I'm allowed to spend it on, which is reasonable. You can't go on a holiday with it, can you? That's not the idea of it. But I assume I can, if I decide to spend it myself, I can top that up in some way and that won't affect the money that I'm getting. Is that fair?
I think you can do that, yes. And also can choose. So the other thing which is important for everybody to understand is that there are two forms of home care. There's regulated home care, where the agency is managed and has to register with the Care Quality Commission, the regulator. Or if you've got a direct payment or your own money, you can choose to engage an individual care worker. Sometimes they're called personal assistants. And effectively, in that case, you become the employer. And quite a lot of people find that quite difficult because there's quite a lot of issues with employers' liability and pay and tax and all of these things. Some people, there are some organisations called introductory agencies where they help connect people who need care with individual care workers offering care. Some of them state that their care workers are self-employed. There is quite a lot of questions about whether you can't just declare yourself to be self-employed. You have to meet certain criteria that HMRC defines based on tax law. And HMRC has intervened in a number of cases and been quite clear that they think it's quite difficult to be self-employed and meet the requirements of the Care Act 2014. One council that I'm aware of was trying to encourage that model. They received advice from lawyers suggesting that they were putting the people drawing on services at risk, because if there were an employment tribunal that found against this approach, then the liability would fall on the person drawing on services, not the council. So this,
What you're saying, if I get this right in my head, you're saying that if somebody uses an independent carer and not going through a care provider, I want to touch on this a little bit more actually. If they're independent, they're self-employed coming into my home, I'm employing them and I might have liabilities with
employers,
HMRC.
well, in many cases, they would meet the requirement or meet the sort of criteria for employment to be a PAYE employee. So that would mean that the person, and quite a lot of people that take direct payments do this. So they are the employer of the person and they will do PAYE and all of the rest of it. But a lot of people do find it quite challenging and burdensome, understandably. And then if your individual care worker leaves or is off sick, then you've got to find your own cover. It's quite hard work. And the number of people taking direct payments has actually gone down over the years, despite the fact that many councils have had a desire to increase it. And I think there's a couple of reasons for that. One is that the direct payment fee rates that are available are just too low. And secondly, it's just all of the hassle involved in having to recruit and do all of the employer activities. It does work really well for some people, but other people find it quite challenging.
It makes sense. But to be clear, it's the same challenge for anybody if they're paying for themselves rather than taking a direct payment, isn't it? If they decide to pay privately, then they've got to make a decision as to whether or not they use a regulated care provider or some self-employed person. So I just want to move on from that. I mean, you've actually answered one of the questions, which is the difference, if you like, between regulated, unregulated, and introduction agencies. We sort of touched on it, but what I'm interested in digging deeper on is what assurances do I get from a regulated home care provider compared to somebody that's come self-employed, for example?
Well, if you're a regulated care provider, you've got to comply with the regulations, which are quite detailed. And there are the Care Quality Commission, and in the devolved administrations, there are equivalent organisations who oversee that. And there will be routine inspections, but also the regulator will respond if there are complaints or concerns or safeguarding alerts raised. If the Care Quality Commission inspects and finds the care provider wanting in any way, they can require improvement, and that can be fairly simple things like, please make sure you fill in this form correctly, through to more radical things like you're not managing your rotas properly, that they may mark a breach of regulation and give you a certain amount of time to get your act together. If a provider fails to improve, they can have their registration removed, and then that means that they're not allowed to operate. If they're doing something particularly bad, the Care Quality Commission has the ability to prosecute, and they do. So providers can get fines, and actually people could be imprisoned for the worst offences. So
Could I
there is
ask a question?
there is
So why doesn't the Care Quality Commission regulate the independent carer
because
that's
the
offering the service?
regulations allow an exemption for individual care workers, and introductory agencies are also exempt from regulation, provided that they are not playing a role in the ongoing management and monitoring of the care. So if all they do is connect a care worker with a citizen, end of story, doesn't count as a managed service. It's if
No.
there's ongoing monitoring support. Also with the individual care workers, because they're not covered by the regulations, there's no mandatory training required. And I mean, when it works well, it's fine. The problem is when it doesn't work, and then citizens find that there's no recourse. So there was an example on television recently that I ended up being interviewed about on Sky News, where there was
I saw it.
a live-in care worker who substituted herself with somebody else without discussing it with the the family, and they realized fairly quickly that she didn't know what she was doing. They reported it to the Care Quality Commission, who sort of said, well, it's not our responsibility. They went to the police, and they basically said that there wasn't really anything they could do. So this is the problem, that there's sort of no recourse for families if something goes wrong. When it goes right, it's fine, but when it goes wrong, there is no comeback.
It almost sounds to me, I mean, my little analogy, let's take doctors that are paid for by the NHS and regulated, and then they go off and do their own thing with no regulation, and they can't be held accountable.
It's a
The
bit
public
different.
wouldn't
It's a bit
accept
different
that,
for
would they?
doctors.
They wouldn't accept that.
It's
They'd
a
say
bit
that's
no.
not right.
I know, and it is a bit different for doctors as well, because they actually have professional registration, so they have to be registered with the General Medical Council, whereas in care workers in England don't have a professional register. Interestingly, they do in Northern Ireland, Scotland, and Wales. However, even in the devolved administrations, it's only the care workers in managed services that have to register, not the individual care workers, which seems a little bit weird to me. I mean, if I would argue that the latter, perhaps you'd want to register, have there'd be a higher priority to have them registered, because at least there'd be some way of ensuring basic standards. Now, I do need to be clear that some very specific definitions in the legislation about what constitute personal care and healthcare. That's all we're talking about here. Things like helping someone go out to see their friends or doing shopping, they don't count as regulated activities. They're not regulated activities. There isn't any need to have training to take someone to go shopping, really. I mean, the person should be able to. But when you're talking about stoma care, catheter care, people with peg feeds, feeding tubes in their stomach and stuff like that, that requires training and supervision. Administering medicines, people should have training and supervision to do that safely. And we do think it's a considerable concern that the system allows people to deliver care without any of that.
I mean, this might be, well, this is outside your remit because I know that you look after the regulated providers. But I just want to touch one final point on this in terms of introduction agencies. You say that they're not managing it, they're just introducing it. And I understand what you say about that. But what's written on the CV might not be what the person has done.
Mm.
Do you make sense? I mean, what have they got no responsibility at all as an introduction agency?
They do basic vetting, so they will do DBS checks and things like that. But there's no, if you're a regulated managed service, the Care Quality Commission under Regulation 19 requires you to produce a very detailed career history, explore all gaps. If anything went wrong and you hadn't properly done your due diligence, then you as a employer, as a provider, would have to face the consequences. I mean, the other thing which happens with introductory agencies is that quite a lot of them do actually do quite a bit of monitoring and management. And that is at one level okay because it's the right intention, but actually, if you're going to do that, you should be registered because there should be a level playing field. There should be one rule for everybody. The reason it's unfair is because the regulation costs a lot of money, and meeting those regulations is quite expensive. So you've got an unfair commercial advantage, and what we are seeing. And it probably will get worse because we've got this new employment rights legislation coming in that is adding employment costs that nobody can afford. There will be a very strong temptation for providers to move into that unregulated market and have more off-payroll care workers.
And some of these introduction agencies, this is a personal comment that I've seen quite a number. And because they're technology companies, because they're a directory and so forth, they get a lot of funding. They get a lot of money put their way, which allows them to market themselves nationally, and it makes them look in terms of their wording. And I would just like to clarify this for some of the listeners. They may say things like that they've been recognised as an introduction agency by the Care Quality Commission. That doesn't mean to say they're regulated by the Care Quality Commission.
No, there's quite a lot of, I think it's very difficult for consumers to really understand this. Even some people who've been in and around the sector for quite some time, even some civil servants don't necessarily fully understand the nuances here. And when you report organisations that appear to be behaving as a managed service, quite often they don't follow up. Of course, there are some very good care workers that work in these introductory agencies. Many of them learnt their trade in a managed organisation and received a lot of training. So it's not right to say that they're not good. That some of them are, but the point really is that there's no oversight, there's no requirement for training, and there's no comeback for the citizen if something goes wrong.
So, as you quite rightly say, there, my last point on this is that families that have an issue, something goes wrong, they may struggle to get a satisfactory outcome for their loved one. And this is personal care. At the end of the day, it's your mum or dad. So be very careful. So that just sort of neatly leads me on again to a next little set of questions, which is how should somebody go about searching for a reputable home care provider? What sort of key questions should they ask if they're vetting, if that's the right word, a home care agency? And And can they use the Care Quality Commission at all to help them in some of their research and decision making?
I suppose there are quite a number of different approaches that it's a good idea to take. Word of mouth is a very strong one. If somebody that has received good quality care, that really helps. And the Care Quality Commission website is a useful resource because you can put your postcode in there and you can get a list of every provider that is in your area, and you can read the last inspection report that the Care Quality Commission produced. Unfortunately, the Care Quality Commission has got a bit behind. That's the polite way of putting it with their inspection programme. So not all of the inspection reports are up to date, but you can also, there are quite a lot of consumer websites now that allow people to leave reviews, or websites such as Trustpilot, or there are some specialist care ones, homecare.co.uk, carehome.co.uk, and so on. And some of the platforms that help people find care, so some of them will have quite a lot of information that they've drawn together to help people choose. So I would advise people to ask around, do some internet search, but very importantly, go and talk to that agency. What kind of response do you receive from them? Are they interested in you? Can they meet your needs? Have they even got enough staff to meet your needs at the moment? If you want a care home, I know we're talking about home care, but you need to go and look at it. Go and see with your own eyes. You wouldn't buy a house without going to see it. And if it's something important like care for a loved one, you need to know who is going to be doing it. And you can ask them about what sort of processes they have, what training their care workers have, what support their care workers have, what technology solutions they use. They do digital care records. Quite a lot of the digital solutions that we use in home care now, they've got a facility for family members to log on, and that's really, really useful if your loved one is far away. In my previous role, we used to have quite a lot of families before there were digital solutions even to buy, phoning up our office saying, "Oh, did mum eat her breakfast? I'm worried, has mum taken her meds?" And now they can just log on and see for themselves in the care record in real time, did the care worker go? What did they say? Was mum okay? And also, there are now solutions that allow people to have video calls and things as well. So things have really moved on a lot in the last 10 years. But I think ultimately it sort of boils down to whether you feel comfortable with the people that your loved one, who are the care workers. And sometimes people, like all of us in life, there are certain people that we get on really well with and other people that we find more difficult. And if somebody is not happy with the care worker for any reason, or vice versa, because that can happen too, then it's just best to say, let the manager of the agency know, have a conversation, and then that can be addressed.
It all sounds amazing what you just said, and it's great advice. Thank you. But are there any resources like key questions families need to ask when vetting a home care agency?
We've got some information on our website under Find Care. There's a lot of good information on Age UK's website, for example, and it can be quite a minefield trying to figure out all of the assessment processes and sources of potential funding. And if you need NHS funding, that's another whole minefield. And there are organisations that will help people as well if they want to apply for continuing healthcare funding, for example. But yeah, I think especially now with AI tools available and Google's just using AI, even if you just go to Google and type in how to find home care, you'll probably pull up some good resources. But our website, homecareassociation.org.uk, Age UK, are probably good places to start. Brilliant.
And in terms of care services that these agencies, these home care providers are going to offer, is it that they specialise in certain conditions like dementia or Parkinson's?
Most home care providers will be generalists, and if you like, and well, when I say generalists, I mean they are very experienced in supporting people with those conditions because they're common conditions for needing care. I can think of an example. We had a gentleman who sadly had motor neurone disease, who was only in his 40s with a wife and 3 children. And the medical consultant that was supporting him came down to our service and met with all of our care workers and the district nurses and explained to everybody about this medical condition, what kind of things might happen, what to expect. And the district nurses trained our care workers with some of the basic things. But then there was a team of probably about 12 altogether who were supporting this family, but they were able to manage it all pretty independently and would only call on the district nurses if they needed any help. Other conditions like Parkinson's disease is quite common, and so the care workers do get quite familiar. I do generally think that there could be a lot more training, though, for some of those conditions, because what to expect, it's sort of then not alarming if something happens and who to ask. And this is why I think having care in these neighbourhood teams, giving that multidisciplinary support. In most home care agencies, they've got very good links with all of these, the pharmacists, the GPs, the district nurses, because they're the kind of people that they will have to work alongside all the time. But sometimes it's not as cohesive and well organized as it could be, and that can be difficult for families because they're trying to sort of communicate with multiple different people, and often the home care agency ends up being the sort of glue. We did a piece of research about hospital discharge, which we published in the summer, and our members told us that on average they spend 4 hours on the telephone for every hospital discharge, because so many things sort of go wrong, like people get discharged without the discharge summary or without the right medicines, or nobody's told them that they're being discharged, or they want this. Sometimes the communication is quite poor, but again, there are technology solutions being introduced that will help that kind of problem. So hopefully over time we will get better and better.
I think the one thing to say at this point, and we're getting towards the end of this conversation, and it's been amazing, by the way, thank you. One thing is that whilst we might feel that the home care professionals are generalists and they've dealt with it 100 times, this dementia or Parkinson's or whatever, for each family, it's maybe the first time they've ever experienced it. So to them, it's the biggest challenge they've ever faced in their family's life. And that's important to recognise, isn't it?
I think it's also, I'd like to flag that there are organisations that can support family carers. So there's the Carers Trust and also Carers UK. They have really helpful resources, and also organisations like Age UK and some of the health charities too, Alzheimer's Society and so on. They've all got valuable resources. So if it's Parkinson's disease, there'll be charities for that. So there is support there, and sometimes there are support groups with other family members that you can connect with who are going through something similar. Cancer would be another one. So
and whilst we're just touching on that subject, I'd like to throw into the mix organisations such as the Samaritans for those people that feel burdened with all the challenges and they don't know which way to turn and they just want a listening ear. There are organisations that won't tell you what to do, but they are there to support you.
Last week I was in Leeds at an event organised by one of our members, and there were some videos of some of the people that they support talking, and there was one gentleman he's going to be 105 on the 21st of December. And I know, and he didn't have home care until 3 years ago. He didn't have any care till 3 years ago. Sadly, his wife died during COVID-19, and they'd kind of managed together completely independently. But after she died, then he needed help with things like couldn't reach his feet to put on his socks and those kind of things.
Oh, yeah.
But he said, don't labour yourself. Don't be afraid to ask for help, because the care workers, they're there and they're so kind and they're so loyal, and they've really helped him. He's still living in his own home. And I think sometimes people worry about asking for help, but honestly, it's so much better to. Even a little bit sometimes can make a massive difference.
And one thing, I was going to ask a question about it, but I know the answer, so I'm going to make out that I'm quite knowledgeable. But families need to understand that care companies can adapt to the changes in the person's health needs as they age or as they deteriorate. So don't worry that the level of service you might start with might be required to get bigger and bigger over time. But that's okay.
Yeah.
That's okay. We understand that.
Yes, exactly. And there is also support from other, so the council is a really good place to go to for help, because sometimes pieces of equipment, the occupational therapists as well, sometimes just pieces of equipment can make a big difference. It might be something that helps you reach things from a height, or a handrail, or now there's all kinds of assistive technology that's available. You can get robotic vacuum cleaners and gadgets that will switch off your oven automatically, and I mentioned video calling and motion sensors. So there are wearables, or you can have very cheap little sensors that can be sort of velcroed on. So if you're concerned about somebody, you're worried about that they might fall and nobody find them, that there's all kinds of very non-invasive, non-intrusive technology solutions that can be used. And again, speak to the council, because if you go on their websites, they all have information about assistive technology, and they've got connections in with the equipment suppliers and so on. So there is a lot of help available.
You've stolen my thunder there.
Oh,
That
sorry.
was going to be my last
Oh,
question
sorry.
about technology. How dare you?
Sorry.
So I'm going to ask another question. Can home care providers support you with social and emotional needs, not just physical care?
I would say that's really a lot of what they do. And some of the people that everyone supports, the care workers are literally the only people they see sometimes. But what, ideally, in an ideal world, what the care workers have time to do is connect people with their communities, take people to help people go to lunch clubs and things like that. So they have their own network of support. Some councils are actually commissioning home care. In Leeds, for instance, they're calling it community health and wellbeing, not home care as such. And the idea is to sort of encourage the home care agencies to work alongside the voluntary agencies, just to try to empower people, really. To, cause one of the things that can happen is, especially if people lose mobility, I'd say that's the number one problem, because if they lose mobility, they lose confidence, they then end up being stuck in their houses and then that makes them lonely, and that can then affect their mental health, and lots of things sort of go downhill. So if you can somehow keep people engaged with their community, and quite often as well, I live in a rural part of England, and we've got village agents in some of these rural communities, and the GPs here, they've been very proactive and taken a lot of initiative over the years. So they noticed that quite a lot of people were turning up to their surgeries that didn't actually have medical needs. There was a couple who turned up in a GP surgery, really quite elderly, and it was obvious immediately. I'm only repeating a story I heard. I didn't have direct experience of this, but they weren't really coping. They weren't sort of, their self-care had fallen by the wayside, as it were. Somebody went to their house and it was in a real state. So they first of all tried to sort of engage some people to be paid to go and do cleaning, but they all volunteered. So the community sort of rallied, and then people found some secondhand furniture for them, and once people knew that they were there and that they were struggling a bit, they'd just drop in to check that they were okay. And people are so willing to do that kind of thing if they know that that need is there. So having some of that community sort of wider networking and somebody to slightly organize that, I think, can be really helpful, and it helps people to help each other, which everyone is actually quite keen, quite willing to do, in my experience. We saw that in the pandemic. Obviously it's different from giving a lot of care, I'm not talking about that, but just sort of dropping in to check on people.
Yeah, you're absolutely right. And there's a couple of charities that I've been involved with that part of what we do is offer to just be there for somebody to do silly little things, like you want some rubbish taken out of your garden.
Yes.
It can be anybody. Well, I've got a car. They don't. So I'll go and pick it up and take it away. Those little things make a huge difference, don't they?
Yes, and Age UK has a befriending service, so that they will do phone calls to people that are on their own. And I mean, there was the Technology Enabled Care Association. They've got a video of a lady called Pat or Pam, I can't remember, and she lost both her husband and her son in quite quick succession, and she'd been married for 65 years. And she says in this video, which is on YouTube, that she spiraled into a dark place, which most of us would in that situation. And her biggest fear was that something would happen to her and nobody would find her. And her local council, which was Mole Valley, were brilliant. They went in there, they put in some, as I mentioned, very cheap sort of motion sensors and things. They also connected her with somebody in the local community who took her to an art class. And I think she might have had a little bit of care, but not all that much. But she said at the end of the video, with a great big smile on her face, I now feel I've got my life back. And in the great scheme of things, that wasn't like a massively expensive intervention. It was,
Mm.
yes, some technology solutions, connecting her with meaningful activity that she liked in her community, which also got her in touch with people. And then I think there was some care and support, and to help her through that difficult period of bereavement.
So there are good news stories out there. And before we finish off with looking at the future of home care, there is just one last question I have in terms of home care today. One of the big questions that I've been asked over time is, how do I know if the care worker's any good? So the question sort of is, how do agencies ensure they recruit the right staff, and what sort of training and qualifications do the carers need to have or should have?
Well, again, like in any walk of life, you've got some care employers that do that brilliantly and others maybe less so. The providers that invest a lot of time and energy and money into that will take a lot of care about who they recruit in the first place. What matters most are people's values and attitudes, because you can usually train the tasks. You can train competence to do certain tasks, but you can't necessarily train attitude. So having that desire to improve lives and kindness and empathy, they're probably the number one attributes. But there is a lot of training that has to take place, and there's so many different aspects. Just understanding about the medicines that people are on, how to use equipment, and of course all the equipment, every hoist that you might use might be a little bit different, so you're going to need probably training on each, and that will all be done by agencies. They obviously have to do a full employment check, so disclosure and barring service checks, the employment history, getting references, all of those types of activity. And I think, again, in the best agencies, they will have field supervisors, or they're called different things in different organisations, but they will do spot checks. They'll be monitoring what's written in the care records, which is now much easier with digital, because you can see in real time what's happening. In the past, when the care records were on paper in people's homes, they only used to go back to the office once a month and be scanned in with this handheld scanner. And then the care workers can do national recognised qualifications, different level 2, 3 certificates. They can, in my previous organisation, we had quite a few cohorts that we gave the opportunity to do level 5 in health and social care, and then a number of them went on to university to train to be nurses, and we paid for that with the proviso that they came back and worked for us for at least a couple of years. So you've got all levels, and quite a lot of people actually in the care sector have worked in the care sector for a very long time. So some of the people that are now operations directors and even CEOs started right at the bottom and have worked their way up and have done lots of extra training and qualifications along the way. Might have been in specific, like dementia care. It might have been, we actually also developed a couple of roles called a care technologist. So that was recognising that there were a lot of opportunities for supporting people with, so even just things like social media. How can you make a call to your son who lives in Australia, that kind of thing. And there's lots of some really great apps out that enable people to reminisce about certain decades of life that they might remember. So yeah, there's huge opportunities, and now we've got artificial intelligence tools coming that are the next revolution. There's some incredible developments in robotics. I mean, I'm hoping by the time I'm in my 80s that will have advanced, but even now it's quite impressive what some of these robots can do. But I think at the moment most of them can only they're only like good at one thing, so you might need like a small army to do everything.
Yeah.
And they're quite expensive, but once they start manufacturing them at scale, then the prices will come down. And probably globally, populations are aging and birth rates are falling, so there is a global workforce shortage. Doesn't really matter what country you're talking about. In the Far East, countries like South Korea, China, Japan, they're investing very heavily in automation in all business sectors. So their factories of heavy automation, simply because they haven't got enough people to do the jobs. And if you go into restaurants in South Korea, Japan, you might have a robotic waiter that you order your food at a tablet on the table, and then a robot brings your food to you.
That's incredible. We'll touch on the future in 2 seconds. I just want to finish off with an observation based on my experience, and I think this is something you might agree with and share. If you go to the right sort of care providers, what you tend to find is that the leadership team were a carer themselves back in the day, and they've actually transitioned from being a care worker right the way through to a leadership role. So they know exactly what good care looks like.
Yes, exactly that. And as I said, there are people that have worked their way all the way up to the top, and a lot of them will go out and deliver care still, because that's what they love. They love that interaction with people, and it really does help, because unless you've actually done it yourself, it is quite difficult. It's easy to come up with rotas that are not feasible and to really understand the difficulties. And I still think there's more that we can do as a sector. We probably don't collectively do as much as we could to support care workers. For example, when somebody dies that they've supported for a long time. I mean, in my previous role, we had a care team that had supported one particular man for 22 years because he was a younger person with disabilities who aged. And when he died, they felt like they'd lost a member of their family. It was profound grief that they experienced. I sometimes think that we don't acknowledge that as much as we need to.
Yes, I know many carers that have actually been to the funerals of the people they cared for weeks, months, and as you say, sometimes years. And the one thing that anybody listening should understand is that the care sector really gets driven by seeing somebody improve. When they come through the door, they want to see that they can make a difference, real difference to people's lives, which is why home care is such an amazing sector to work in.
And there's some great examples. I again, at this event I was at last week, there was a gentleman talking about how he had sadly had to have one of his legs amputated because of diabetes, and that was very difficult for him psychologically but also physically. But he was saying that the care team, they encouraged him to try to get out of his chair himself, and gradually he built the core strength to be able to do that. And then, like, the day that he managed to do it himself gave him so much hope. And that it isn't about always just about doing things for people. That psychological, emotional support that you talked about, I would say, is probably more than half of what they do.
You're absolutely right. My ex-father-in-law, he had his leg amputated, exactly the same reason, and we encouraged him to have a prosthetic, which he wasn't going to have at age 84. He now almost runs around. He's got himself a new automatic car, and he's loving life again.
Brilliant.
I've never seen him so mobile.
Yeah, so there's a huge amount that can be done, and again, technology solutions will transform this space as well. Like, there are already like robotic exoskeletons that, if people have lost the use of limbs for any reason, that can help people to walk even if they can't make their legs walk themselves, and that sort of thing. So that there's a lot of, and again, a lot of research in Asia on this sort of thing. I was seeing some sort of robotic gadgets that help people get in and out of bed unaided. So, like, if you don't have to wait for someone to come and get you out of bed, that's very empowering, isn't it? If you can get yourself into a chair and go and make yourself a cup of tea, your quality of life is going to be much better than having to lie there waiting for someone to turn up.
my final thought for the day. We've covered so much, Jane. It's been amazing. It really has. Final thought for the day, and I don't want to play one off against the other, but I sort of do. Why home care and not residential care? I mean, if you were to summarize it, because you're the advocate of home care, you're the person that's out there championing home care. Why home care? And what does it look like in the future, do you think?
I think, as I mentioned at the beginning, in my previous role, we provided care in lots of different settings. So my strong view is it's horses for courses. You will never hear me saying bad things about any other setting of care, because it's very much what that person needs at that time. And there was a gentleman that came into one of our care homes who'd lived on his own for a long time, and honestly, the transformation just for being with other people was huge. And he started eating properly because he wasn't eating properly by himself, and all this kind of thing. So it's very individual, but many people want to remain in their own home for as long as possible because they're in familiar surroundings, in their communities, with the people that they know and love, and they can have their pets, and they can eat what they want to, when they want to, how they want to. They can watch whatever they want on television without worrying about waking up the person in the room next door, etc. So I think that's what it is. It's that connection to what's important to you. Having said that, there are the number of people that I have spoken to over the years who moved into a care home, having been afraid of doing that and not wanting to, end up saying, oh, I wish I'd done this sooner. Same with moving into retirement living setting, because there, on the whole, people still tend to be fairly able to support themselves. Many of them do have care teams available, but on the whole, people reasonably sort of self-sufficient. But if things do change over time, there is the support there. But you've got a community, you've got things to do and people to talk to, and there's been research done in some of those later living communities that demonstrate clearly that healthcare utilization decreases. So people go to the GP less, and a lot of that is a lot of the time people I mean, I'm like this. You sit by yourself for too long, start worrying about things and anxiety. Whereas if you can say, like, I've witnessed a conversation between two women in one of these lounge in one of these retirement places. One of them said to the other, I'm a bit worried about my knee, it's like really sort of hurting and I don't know what I should do. And the other lady said, well, yeah, mine did that, but it kind of settled down, so just leave it a little bit and see how it goes. And that sort of thing is that friendship, I suppose. And as human beings, we need other human beings. People go downhill quite quickly if they don't have any social connection. Loneliness is probably more important, more of a factor driving ill health than almost anything else.
True say. I like that as an ending. And my ending for today is to say to anybody listening, don't leave it too late before you start looking for care, be it home care, a care home, retirement living, or whatever. Just please do not leave it too late. We're here to help. And most of the time, we're not here to sell. We're here to listen and to understand and see whether or not what you need is what we can offer you.
And actually, the earlier that you seek support, the more chance you've got of staying well for longer. If you leave it too late and deteriorate, then you might end up in hospital. Hospitals, contrary to popular belief, are not necessarily the safest and best places to be. So just reach out and get that support early. And it might not be personal care initially. It might just be some support with going out shopping and cooking, or getting the right equipment to help you do things.
Jane, you've been a star. If anybody wanted to find out more about the Home Care Association and get in touch, how would they find you?
We're on the internet, homecareassociation.org.uk. There's a contact us tab on the website, which has got lots of useful emails and phone numbers. There's also a lot of information on there, so you can search that. We've got a facility, as I mentioned earlier, Find Care, that's got quite a bit of information on there.
Jane Townson OBE, Chief Executive of the Home Care Association. Thanks for your time on the Chasing Care podcast today. It's been amazing.
Thank you, Gavin.